Shidlofsky, and I want to thank Dr. Glazer for inviting me to do these, what's going to be monthly little vignettes on neuro-optometry for ODs on Facebook. So I'll tell you a little bit about myself. I've been in practice since 1988, graduated from Southern College of Optometry, and have largely, for the majority of my career, worked in the area of vision therapy, vision rehabilitation. Started out working with kids who could have been learning-related vision problems, autism, ADD, ADHD, strabismus, amblyopia. But about 19, 20 years ago now, I ventured into working with traumatic and acquired brain injury. And that's about half my practice now. About half the practice is traumatic and acquired brain injury, and about half the practice is pediatric and developmental. That's primarily all we do in our office. My office is located in Plano, Texas, and once again, I'm just thrilled to be here to do these little 5-minute vignettes, telling you a little bit about what we do. Today, really, I wanted to cover just some of the things and topics I want to discuss over the next few months, and I think really that's. And I really hope to get feedback from those of you out there if there's specific topics you want to hear. But some of the things we're going to talk about is how we do neuro-optometry here in the office, but we also see patients at a couple of rehab hospitals. So I want to talk about hospital-based optometry versus your office-based neuro-optometry, and the differences on how we approach something that might be done here in the office versus something that might be done in the rehab hospital. And what is our goals for those different treatment types or regimens. I want to talk about testing the neuro-optometric patient. What tests can we use? What should be our testing sequence? What are the things that we want to look for in a testing battery that would encompass a patient who has some of these different situations, whether it be a pediatric case, or a strabismus case, or a traumatic or acquired brain injury case. So lots of different things within those different scenarios. And then once we talk about testing, we want to talk about treating. What are we going to do in treatment of these patients? There are different types of therapies we consider. There's passive therapies where we use lenses, prisms, tints, occlusions to create a therapeutic change in the individual. And then there's also active therapy, which most people call vision therapy, but I like to use the term neuro-vision rehabilitation better because it's really describing what we're truly doing, and that is we're changing the eye-brain connection. And largely, I think that is what I try to impress upon patients as well, is that we're really not changing the eyes. We're not changing the physical structure of the eye, but we're changing that connection between the eye and the brain. I also want to talk about referral patterns. I think today there's so much of us that do subspecialty work within optometry. I know that's kind of a tricky word, specialty, especially in some states. But there's a lot of optometrists out there, whether they do dry eye, or they do neuro-optometry, or have a contact lens specialty. I think we should talk about referral patterns, because optometrists should refer to optometrists first and foremost. And then if the need be for higher level treatments, and then we should consider referring to ophthalmology. But we really need to think about changing our referral patterns to give the patients the best care possible. And then we'll discuss different types of patients or different types of cases. We'll cover over pediatric and developmental cases. We're going to talk about concussion a lot because concussion is such a hot subject now, especially in the world of sports. Currently, I am the team eye doctor for 3 professional sports teams: the Dallas Stars of the National Hockey League, the Allen Americans of the ECHL, and FC Dallas. And I think some of my experiences working with professional sports teams and even amateur athletes, college athletes, will be something very well discussed and very, very important to discuss, especially in the realm of concussion. In fact, concussions opened a lot of doors for us in working with these sports teams because they wanted someone who could handle the visual problems related to concussion, but they also wanted someone who can do vision enhancement. And so working those two things hand in hand has been a huge help. We'll also talk a lot about stroke patients. Sadly, I'm seeing younger and younger stroke patients. I'm seeing a lot of stroke patients in their 30s and 40s and 50s, where we always assumed they were going to be someone in their 70s and 80s. So is there a reason why we're seeing this? So that's another area we're going to talk about. Currently in our office, we're working on a study for something called visual snow syndrome. We're one of the 2 offices in the country doing this study right now, and we're going to have the results of that study out hopefully by the end of the year this year. But there are definitely some things we can do for patients who are exhibiting symptoms of visual snow, migraine headaches, things of that nature that are related to visual snow syndrome. I've definitely treated many patients at this point with this syndrome, and we've had some good success when nothing else has been successful in improving these people's lifestyles. We'll talk about immunological and neurological issues. We'll talk about genetics and vision. I think that's a really interesting topic. We'll talk about patients with brain tumors. Brain tumors are a brain injury at the end of the day, and I've seen quite a few brain tumor patients over the last 10 years or so, and there's a lot of things we can do to help them improve their lifestyle. And then we'll come up with some cases and we'll review some cases. So there's really a lot of great things that we can really do to talk about neuro-optometry. But as I said at the beginning, I'd love to hear from you as well. And hopefully we'll be able to reach out to each other on ODs on Facebook and cover different ideas. If you have an interesting case you want to discuss, feel free to reach out to me and we'll talk about that too. So for now, I'm going to sign off, and I look forward to bringing you the next chapter in this next month. And once again, thanks to ODs on Facebook for having me be part of the team.